Society.
Sorry, go ahead.
Thank you, Shilpa, for your kind introduction. My heartfelt thanks to Jain Society of Metropolitan Washington, D.C., and the organizer, Shilpa Shah, for giving me this opportunity to present today. Here, you're going to see the wind behind my wings, which keeps me going. This is my lovely family. Most of you will know, who have known me, that they are my driving force in my professional progress. So some of you may wonder, why is a dentist talking about snoring and sleep apnea? Let me clarify. Sleep apnea is a complex medical condition which requires collaborative care of multi-specialty. And one of the treatments of this disease is an oral appliance therapy, which can be treated by a dentist who has advanced training in sleep medicine, just like any sleep physician. I am pleased to see that such great interest in this topic, which I am very personally passionate about. And just so that you all know, I am speaking today from both perspectives, as a patient and a perspective as a provider of care. So why is this such a huge interest? In America itself and worldwide, actually, this problem has overtaken any other disease under the sun, as we know in medical healthcare. 20% of US population has the disease of obstructive sleep apnea. Only 10% has been diagnosed so far. People need help. So the content of this webinar and presentation, I have to have my disclaimer. The presentations for educational and information only. Any medical and any other information is purely information. It's not an advice. It is not intended to be substituted for professional medical advice, diagnosis, or treatment. Always seek advice of your professional physician or other qualified healthcare provider with any questions you may have regarding the medical condition. So today, let's talk about your health and the health of your loved ones as it relates to sleep, whether normal, abnormal, and its effects and treatment options that are available. So as humans, we sleep away 1/3 of our lives. Have you ever wondered why? Nature must have its reasons. Sleep is essential to health. Sleep is a biological necessity. We forget that sleep is a basic human need, fundamental to our health and well-being, just like air, food, and water. However, sleep does not get the respect it deserves. Healthy sleep requires adequate duration of time, good quality, appropriate timing, regularity, and absence of sleep disorders. Insufficient sleep and untreated sleep disorders are detrimental for our health, our well-being, and public safety. So why sleep? Why do we need to sleep? And what happens during sleep that matters to us? Field of sleep is a new, only few decades old as a specialty, and we are still at the beginning stages of understanding it. We do not yet understand why we need to sleep, but our research shows us that if we do not sleep, we die. Nature has given us 16 hours of use and abuse and 8 hours of rest and digest, which is sleep. Unlike popular myth that sleep is lazy, unproductive, dead time, passive activity, it is actually when your body and brain are the most active stage. Let me give you an example. What happens during sleep? If you have a car with an engine that is not doing well, you need to have a mechanic look at it. Would that mechanic repair the engine with the car running, with the engine running, or he has to turn off the car? Sleep is the same exact mechanism nature uses to help us heal. When we rest and digest, sleep is when the body rests and rejuvenates. It is our reboot system for our human body. So nature has given us all the doctors and all the pharmacists repped in, which costs us $0. We only need to learn how to respect it. Although we don't know why we need to sleep, we do know it is necessary for optimum performance of ours, including our cognitive functioning like memory, thinking, learning, our physiologic functioning like our heart health, our metabolic health, our immune system, and our emotional well-being. When we sleep, our brain actually goes through a dishwashing cycle. Because we are living human beings, we accumulate a lot of byproducts in our system. And brain is when we sleep, is when it cleans itself out. And this is when all the hormones in our body, the growth hormones, our hunger hormones, all these things are self-balancing. That is why sleep is such an important part of our life. We in United States, and when I say this, I have statistics because I know people have joined in from all over the world, but the problem is worldwide and not just in the United States. The statistics I have is because where I practice. 42 million people in the United States currently are suffering from some kind of sleep disorder. Only 10% has been diagnosed. And out of that 10%, only 25% is treated successfully. So snoring, 60 to 70% of adults snore. When we look at the sleep statistics, 40% sleep less than 5 hours a night. Just like not taking vacations, working through lunch and being busy in America, we wear lack of sleep as a badge of honor. Fatigue, tiredness is a cross to bear in pursuit of happiness, as if exhaustion is a requirement in fulfillment of our American dream. While brain cannot conjure food or water where there is none, it can force us to sleep. It is called microsleep. It might last only for a few seconds, but if you are driving on the road or you're conducting a delicate surgery, that involuntary nap could have a critical consequences. So folks, chronic sleep debt, like your credit card or mortgage debt, doesn't go away. You will pay back with interest in deteriorated performance, slower reaction times, and your deteriorated health consequences. Only if we understood that sleep deprivation causes same havoc on our body and health as physical stress, we may start to think differently. So what happens when we sleep? We cycle through 4 stages of sleep, 4 to 5 times a night. Each sleep cycle is 90 to 110 minutes. Sleep is divided into the 4 stages, but the main 2 division we look at is as a non-REM sleep and REM. So non-REM sleep is the sleep which is 75% of the night we go through, and REM sleep is the 25% that is our dream sleep. Each stage, we have to cycle through each of this stage for nature to heal us automatically. Remember what I said, we don't need doctors and pharmacists. Nature does its job. So during the first stage of sleep, drowsiness happens and the sleep begins. All our muscle activity, our body slows down. Practically, nature is calming our body with our heart rate, our blood pressure, our body temperature. Everything starts to balance itself. Then the second stage of sleep happens where the brain blocks out all the sensations, so we are in a deep sleep. And the third stage is where the growth hormones release, our hunger hormones, our sex hormones, our endocrine hormones. Every single cell in our body has a 24-hour cycle, and it has a self-healing metabolism in itself. Then we go into REM cycle, where our body goes into total what we call disconnect from the rest of the world. The only thing that works, we paralyze. When we paralyze for our REM cycle, the only thing that is working is our brain, our heart, and our lungs. For all practical purposes, we are dead to the real world. We need to go through this REM cycle. If we don't cycle through this REM cycle, we die instantly. We have research that we have done on mice. We can't just replicate on human. But one of the reasons Michael Jackson dropped dead was for this reason. He did not go into REM cycle with his drug abuse protocol. So snoring. Our airway is like a water hose pipe, wide, flexible tube from nose down to your throat. What happens to the water hose pipe when you kink a little? A water turbulence increases and it makes the squeaky sound. The same way, snoring is an unpleasant sound created by the vibration of their soft palate due to obstructed air movement during breathing while you're sleeping. Loud sound you hear is due to the turbulence caused by the same amount of air you always breathe being forced through a narrower space like a straw or a stutter. Snoring is kind of a thunder before a storm which kills. It is a nature's alarm bell given to us telling us something is wrong with our breathing. Do we hear it? We all do. Do we absolutely listen to it? No, we adapted to it. Loud chronic snoring is not harmless. It is a symptom of a serious life-threatening condition called obstructive sleep apnea. So how many of you know that you snore? How many of you know that people who snore? And how do you know it? The snorer never knows unless an observer tells them. So, is that snoring normal? Snoring is not a lullaby for children or adults. It is not normal. We should all be snoring at all times if that is what nature meant us to do. We know estimated 60% of the adults snore occasionally, but 25% of them snore consistently, often disturbing their bed partner's sleep and possibly their own too. You're more likely to snore when we are overweight as we age. We are men, we are postmenopausal women. These night noises seem to worsen with age. So how did we respond to this problem? So instead of addressing the problem, we adapted to it. How did we adapt? We do the elbow nudge and the spouse gets the bruised ribs so we can spend like sleeping all night long, or we do invest ourselves in fancy beds, pillows, nose strips, bed wedges, earplugs, chin straps, white noise, and the list goes on and on and on. And if nothing else worked, here's our other solution. We started sleeping in separate bedrooms. We are sleeping on the sofa, in the living rooms, in a hotel bathtubs, avoided traveling with friends in fear of sharing a room. We started, but one of the side effects of snoring and interrupted sleep is excessive daytime sleepiness. We can sleep anywhere, anytime, any day, and people think it's a blessing. You look at that and you have to wonder, it's not a blessing, it's a disease. You should only be sleeping for 8 hours at nighttime. So when we are tired and we have that sleepiness, what do? We give caffeine kicks. We support Starbucks, Dunkin' Donuts, and We have 5-hour energy boost, Red Bulls, Cokes, you name it, just to keep our eyes open during daytime. Sleeping aid markets in America went from 64 billion in 2019 and is expected to reach 101 billion by 2026. All the sleeping pills like Ambien and Lunesta and Triazolam, you name it, is available. Tylenol PM, Advil PM, anything that will help us drop unconscious for 8 hours does not mean we are healing just because we are unconscious. Because if we are not cycling through the stages of sleep, we are not healing. When we cannot fall asleep naturally, we have learned to love alcohol, which again knocks us out unconscious, but doesn't let us cycle through the cycles of sleep stages to heal. So since snoring is the sound that is bothersome, most of the people are looking for solution to stop snoring. However, this is a disease continuum. Snoring is not a joking matter with patients often coming in for treatment. I see it in my practice every day, simply to appease their annoyed spouse. Think of snoring as an alarm, fire alarm, and the disease behind it is sleep apnea, which is a fire. So snoring is an alarm, and if there is a fire and the fire alarm goes off, if I disconnect the alarm, does it mean that I'll put out the fire behind it? No, the fire is still continuing to burn. So we have to understand and diagnose this disease before we start treating it. So what is this? Human need for survival is breathing. It's a prime function of our brain, mind, and body. Everything we do is to wait and take the next breath. Everything else is secondary. So when we talk about apnea, what does it mean? It means without breath. In simple term, we are suffocating. Sleep apnea is without breath during sleep. During daytime, we can compensate, but at night, when our compensatory mechanism is compromised, we are suffocating in our sleep. Obstructive sleep apnea is breathing stopped when there's physical obstruction in the airway. Your body basically is choking on itself at night. And central sleep apnea is when breathing stops caused by neurological condition where the body is forgetting to tell you to breathe. And the mixed apneas are the combination of the two. So what is sleep apnea? It is basically a downward syndrome. As we age, we are only going to sag inside and out, losing muscle activity and tonicity. We can treat it at the beginning or at the tail end of this disease. The only difference is the disease is a progressive disease, it will gather all the different diseases if we do not treat the cause of the disease. Estimated 9% of women and 24% of the men suffer from obstructive sleep apnea. So when you look at the slide, the normal breathing is a tube that is running normally like a straw tube, imagine. When that kinks and the same amount of air needs to go into our body, it creates a vibration sound, we call it snoring. When it kinks even more, we call it upper airway resistance syndrome. And when there's 30% or more difference of air going into the system, we call it hypopnea. And then it closes 100%, 10 seconds or more, we call it apnea. And afterwards, it leads to what we call hypoventilation syndrome. So the apneas are divided into obstructive, central, and mixed. And we do the study, we divide it into mild, moderate, severe. I would rather define it as stage 1, stage 2, and stage 3 of the disease process. Let's watch a video on what sleep apnea looks like. So you see what this disease looks like. The irony about this disease is the person who's suffering is unaware of it, and the observer is annoyed by the sounds. And they're scared to death of losing their partner looking at them. The public enemy of this is number one is lack of awareness of this disease, which is most underdiagnosed and undertreated. What you looked at here is when the person is sleeping and when they paralyze, the big fat jaw and the tongue, the airway is behind your bottom jaw and your tongue. It falls back and it obstructs your air going into your system. When there's no air going into your body, your heart runs a marathon trying to provide oxygen to your body from head to toe. When it doesn't have enough air coming in, it basically sends a 911 signal to your brain saying, wake up, buddy, I don't have air. And that's when you go gasping for that big breath. You again gasp for breath. It interrupted your sleep, correct? You're not aware of it. It's called microarousal. When you wake up in the morning, you don't remember any of those things that is happening at night. And that's why people are not aware of it. When it gives and wakes you up, so you never go through the sleep cycles you need to feel your healing that needs to happen. So what happened? Why is this disease increasing and we are seeing more and more happening today? If you look at this picture from where we were few decades ago and where we are today as humans, what is happening is we are evolving. Our airways used to be a big wide open tube. Look at the humans today. As our jaws started to move back and as our jaws started to constrict, we started encroaching on our own breathing mechanism. And why is this happening? Because we went from, and it started from childhood, we went from breastfeeding, which helped us normally develop our jaws and our heads. We started eating softer foods. We are not eating foods that needed our jaw growth to happen. We are increasing in our weight. All these things, we have allergies, all these things have led to develop our head and neck region, which is kind of having what I describe it as a garage. We used to have a garage that would fit a Mercedes. Now we have a Hugo garage and we have a Mercedes in there that we need to fit in. And it doesn't have any other place to go except at the back of our throat, and it basically chokes us. So here is where all the reasons that I gave you is the reason why our jaws are constricting. So this is the changes that we see in our face complex in our head and neck region. Instead of having a broad, wide jaws that accommodated a big tongue of ours, now we have what we see kind of a square, triangular faces. Our faces are changing, and so is our airway behind it. So it's a startling number that we have now. 40 million people have trouble sleeping and breathing at the same time. Most of us are aware of understanding that we need a good diet, we need good exercise, but few really understand the adequate quality of sleep in avoiding the diseases like heart disease, high blood pressure, stroke, diabetes, weight gain, and the list goes on. So the consequences when you have an interrupted air circulation at nighttime in your body, Basically, your body is under constant stress all night long. It is like lions are chasing you all night long, and you have high cortisol levels. Your body doesn't go through the healing phase of sleep cycles. And what happens? You have sleep apnea. With sleep apnea, you have 2 times higher chances of heart attacks, 6 times higher chances of car accidents, 3 times higher chances of diabetes, congestive heart failure, 4 times higher chances of stroke, and high blood pressure. We treat all these diseases. When you have a symptom, you say, I have high blood pressure, I have a medication to give you. Nobody actually asks you a question, why is this happening? And I will give you $1 every time I hear it's genetic. Genetic component to any disease is only 10% to 12%. The rest of it is how body is reacting to whatever underlying condition, but we are treating symptoms, we are not treating the cause. So obstructive sleep apnea is a disorder that can cause individual to have involuntary sensations in breathing throughout the night. This stopping and starting of breathing happens because of the soft tissue collapsing in our throat, and it creates blockage in our airway. This blockage prevents air from passing through, and it jolts the person awake, having to gasp and choke. In the most cases, this will go unnoticed. The only symptom they feel is I'm tired during daytime. Even after getting a full night's sleep, they will never feel rested. Then the people in the family start to notice that they're woken up by the bulk of these patients are undiagnosed, don't understand the condition well enough to pursue. And the potential health consequences is what you're seeing here. What I call this is a circle of misfortune. You normally see the patient after they have all these diseases, they have complained. Nobody has told them, do you have any problem sleeping? And can we do a test? So 90% of the females are told you have anxiety, you have depression, you will go get the medication for it. Rather than do all this, you need to have a good night's sleep to help and heal. The consequences of obstructive sleep apnea is it can even cause death. And if you ask yourself, what are we doing in your sleep that we die? Sleep, nature gave us to rest, rejuvenate, repair, refresh, and wake up so we can face another day. It's only during sleep that when there's no air going, it gives us heart attacks and strokes, and people die in their sleep. These are the diseases. If you have any of those diseases, 83% of the time, people who have high blood pressure have underlying sleep apnea that is not being treated. When you are putting on weight and you can do diet till the cows come home, but not lose an ounce, you have underlying sleep apnea that is not helping you balance your hunger hormones. Patients with 76% of the patients with congestive heart failure have underlying sleep apnea. People with pacemakers have underlying sleep apnea. Atrial fibrillation, 49% of the patients have underlying sleep apnea. Same thing with diabetes, any other coronary artery disease. So what is the independent factor? People who have heart attacks, when you are normal with no other odds ratio, you have the chances of heart attacks. If you are obese, 7 times odds that you will have a heart attack. If you have high blood pressure, eight times the odds ratio. Smoking is 11, but guess where underlying sleep apnea is? 24%. Your odds ratio is you will have a heart attack if you have an untreated underlying obstructive sleep apnea. So why is this disease not at the forefront? Part of the problem is public awareness. Public awareness about this disease is nil. We have accepted all the parts of our tiredness, fatigue, anything we do as a normal. So nature is kind. We adapt sickness or health as our new norm. Until you see the difference, you cannot tell that what is healthy and what is disease. Most people consider snoring as a deep sound sleep. It isn't. Awareness of the consequences of this disorder and healthcare providers is also poor because of our educational biases, and we adapt both ways equally. So we need to educate not only the public, but including our medical world. So if you have an untreated sleep apnea, it will take away 12 to 15 years off of your life. Smoking does only 7 to 10. Type 2 diabetes only does 5 to 10. But obstructive sleep apnea increases the risk of your dying by 46%. So what do we need to look at? What are the symptoms of looking at this disease? When we are screening, as soon as we start looking at patients' medical history, they have high blood pressure, they have heart disease, they have stroke, diabetes, high blood pressure, any of these symptoms on excessive urination. If you're waking up 10 times at night, we normally say, oh, you have benign hypertrophic problem. It isn't. If you have acid reflux, you're taking tons of medication. In children, ADHD, children actually hyperactivate when they don't have good quality sleep, while adults become tired. If they have bedwetting problem and they have failure to thrive and grow. So when you look at a medical history, you have to ask, what is causing all these diseases? And we have a society of medical management. We are not preventive-based society for health. We manage symptoms. If you tell me I have high blood pressure, I have a medication. You tell me I have depression, I have a medication. Nobody asks where that depression is coming from. Why does this patient have a high blood pressure? On your sleep history, people have to be aware. Do we snore? Do you gasp for air? Are you sleepy and tired all day? Do you have memory fog? Morning headaches. People have headaches all the time, and most of the time, if you have at nighttime not enough oxygen going into your system, CO2 levels build up and you have morning headaches. And if you are not going into REM cycle, you will have migraines, you will have cluster headaches. So headaches, one of the biggest cause of headaches is obstructive sleep apnea. You cannot remember things. Irritability, when you wake up and somebody tells you you're really not in a good mood, somebody says, which side of the bed did you wake up from? Does it make sense? It's telling you that the patient did not get a good night's sleep. That's why they woke up the way they feel. Your decreased sex drive, people breathe through their mouth, they cannot perform as well as they should. So when we look at, when a patient walks through, if the head walks in before the patient, we know that they're protecting their airway. They have a breathing issue. If your jaw is set back, obstructive sleep apnea is a disease of neurophysiology. That means how the brain gives message to your lungs. It is a disease of what we call craniofacial. That means how your head and neck region is formed. And it also is a disease of environmental influences, allergies, and iatrogenic, which I call that we have made this disease worse. So we look for all these signs. See the bags under the eyes? This patient is telling me a story that they're not sleeping well. This kid is telling me a story that somewhere in his breathing problem, there is an issue. They cannot breathe through their mouth. They're breathing through their mouth. Mouth is an emergency route of breathing. We should only be breathing through our nose. When we take a look in your mouth, look at this tongue that is scalloped. What it is telling me is to breathe, that patient is pushing that tongue against this teeth. So teeth are the gateway that is choking us to death. This tongue needs, for breathing, he needs more room at the back of his throat. and this tongue is being pushed forward. So you see the scallop tongue. I don't need to do any study on this patient to get the results. I can almost tell you this is 90% diagnostic. We need it for the insurance people to get the study done. See this big fat tongue? When you put on weight, you put on weight on the tongue. Unfortunately, when we lose weight, the tongue doesn't lose as much amount of weight and it's still choking us with the disease. When the patient has GERD, acid reflux, they're eating away their own teeth. Look at this patient grinding. He's grinding to keep his airway really hold patent. So they grind their teeth. But as a dentist, we look at those teeth and they say, oh, I need to save this person. I'm going to give them night guards. Night guards are not a solution to them. See this mouth, the constricted jaws, deep bites. It's at the back of your throat. This is congestion. We are all fighting for air when we look in the patient's mouth. So this is a big no-no. I have a license to save somebody's life and I have a license to kill somebody quietly. So if I don't know about sleep apnea and the history of what is going on behind the patient, as a dentist, I can give you a night guard. And if you are a sleep apneic, I will make you 50% worse, which is not the intention, but it's subconsciously. And business of giving night guards for patients to save their teeth is in billions of dollars. But this is not the solution for somebody who's suffering with sleep apnea. So how do we diagnose patients who have sleep apnea? We have two different options. You can do a study at home or a study in the sleep lab. Most of the studies initially were done in the lab, and they are what I call an accurate study of an inaccurate night's sleep. But it gave a good detail. So it is absolutely a great study to do it in the lab. But with COVID and our scenario today that is happening, we now have at-home sleep study where patients are getting to which is inaccurate study of an accurate night's sleep because you're sleeping in your own bed, but it is helping us diagnose many, many more patients than we did before. So what is our treatment options? Depending on where we fall, whether we have an initial disease or we are at an advanced stage of disease, lifestyle changes and sleep hygiene is number one that we need to focus on. Then we have a treatment, which is a treatment of CPAP. In America, we have 95% of people getting a CPAP machine. Only less than 50% of those people actually put it on their face and use it to make any difference. Oral devices are only prescribed 5%, but their compliance rate is 100% and their success rate is 90%. Then comes surgery, and then comes cognitive behavior therapy. So what are the lifestyle changes we need to do? We need to maintain healthy weight. We need to stop smoking, stop using alcohol, excessive caffeine that we ingest, stop using sedative medications. Those medications are addicting and are only meant for a temporary few days use. And exercise, your best time to go to sleep is with good exercise. What are the best sleep tips that we can have? Sleep, we should always have a fixed bedtime routine. Bedroom has been inundated today's day and age with all the gadgetry like iPhones and iPads and televisions and dogs and cats. Think about bedroom as your only for sleep, sex, and sickness. You do not want bedroom is kind of your happy healing place. Think about it as a temple of healing. Bedroom temperature should be 65 to 67 degrees Fahrenheit. You always want to have warm shower before bed and dark, noise-free bedroom. That is your basic need of a great good night's sleep. You have to remember Meds also interfere with a lot of your sleep. So psychological diseases like depression, anxiety, stress are often associated with sleeping difficulty. So here's the two treatments we spoke about, the CPAP machine. So when you give CPAP machine, somebody who's suffering from obstructive sleep apnea will use it for a day or two and feel great because it controls your sleep apnea 100% of the time. Guess what happens in few days? We are all humans. It sits in our closet along with our vacuum cleaner. We keep collecting all our supplies. It has a poor compliance rate. Mask is discomfort, restricts mobility and your travel. So who wants to feel like a patient rest of your life, right? Nobody. I did not, I can tell you that. So here is your alternative treatments. If you don't want a CPAP, what is your choice? You have oral appliances. Oral appliances are all the different kinds that you see. They're simple, they travel well, it doesn't restrict your movements, and they're easy to use. Yes, they need to be calibrated and it takes a little more time, but it is customized to you as a person. And it works with 80 to 85% great results. So pick your poison. That's what I say. Whichever one you are comfortable, it is your disease. Whichever one makes you happy, that is what, and you will be comply with, that is the treatment you want to choose. They both work. So who sends us my patient? My patient pool comes from sleep lab, sleep physician, cardiologist, neurologist, you name it. Any doctor who looks at a patient as a whole and says, let's get to the cause to treat you, they are the ones who will normally refer. Now, that said, there is so much that everybody is blinded with their own field that they don't have time to look at any other choices. So we have a siloed medicine. A cardiologist only looks at the heart. A urologist only looks at his field, the ENT looks at, you will have to tell them and request if your sleep is not as good as you would like it to be. The protocol for treating with oral appliances, we have to evaluate. I use teeth as an anchor, so we go through the entire process. It takes 3 to 6 months to get where we want to, and then once a year as a follow-up. But we work with sleep physicians in coordination. So most of the questions that I have, and I hope to answer them for common people. Does medical insurance cover the oral appliance therapy? And the answer is yes. The second most common question is, does oral appliance therapy cause TMJ problem? No, they do not cause TMJ problems. They actually help heal TMJ problems. What is the success rate, which I already told you guys, it's 85 to 90%. There's 10% who will need a combination therapy. So the other treatment, most of the physicians say, if you lose weight, your sleep apnea will go away. No, it doesn't. It's me telling you, if you stop eating salt, your blood pressure will go away. No, it doesn't. It's still there. It becomes better controlled. I've heard oral appliance therapy do not work. I'm a live example. I have a whole field dedicated to it. They do work and they give excellent results. And if the oral appliance therapy doesn't work, you always have alternative. It's like no one therapy is meant as a panacea for treatment. If one blood pressure medication doesn't work, you need another one. It's the same way. If one therapy doesn't work, you have CPAP, you have surgery, everything. The cost of the treatment is dependent on reimbursement from the medical insurance. I wish I could have a clear-cut answer for that, but unfortunately, the insurance company rules the roost there. So what is the summary? It is sleep apnea is a disease from newborn to old. It is a disease of thin or fat. It doesn't distinguish. I've seen it both sides. And it does not discriminate in any way or form. Today on the road, there are more accidents happening from people who are drowsy driving rather than drunk driving. People with untreated sleep apnea are 12 times more likely to be involved in accidents, automobile accident. A drunk driver will try and swerve and save the person in front of you, but the drowsy driver will only wake up with a thud. 168 million people say they drove drowsy in the past year, and more than 103 million admitted at falling asleep at the wheel. That is a scary number. We all need 7 hours of quality sleep for vital to our health and well-being. Snoring is annoying, but it is also dangerous, and sleep apnea kills. CPAP is not the only answer. So folks, sleep matters, and only you can prioritize it. Skimping on sleep weakens our immune system, makes you more pessimist, and to say the least, it is making us fat every day. So that said, I am hoping that you sleep well, breathe well, and live better. Any questions? We're going to open it up.
Well, thank you, Dr. Parmar. This was a very interesting and informative topic for sure. I know this is my household problem for sure. So you can either put your questions on chat or you can ask directly to Dr. Parmar.
Is everybody unmuted, or can they unmute themselves?
Yes, they can unmute themselves.
I have a question.
Go ahead.
The question I have that when you go to primary doctor and the primary doctor checks the situation, or what you call the circumstances and your disease, and then they send it to sleep apnea. After that, they do the diagnosis, like they make you sleep overnight and check and all 9 yard stuff. After that, they decide that we have to get the sleep apnea, that you need the mask on your head. But now, once they give that one, can we argue with them, or can we discuss with them, or can you tell them that, hey, we don't like this one, man? And as you told them 9 out of 10 times, it happens that you wear that for maybe a month or so, and then sitting in the closet, and it's having the dust on it, and we don't wear it because it is annoying. So now, after doing that one, and when you go back to primary doctor, or we go to, because they don't send it to sleep apnea, they just send once the primary doctor get the result from the sleep apnea, they just write down the prescription and they tell the prescription that, okay, this person need this, what they call the mask.
Machine. Yeah, CPAP machine.
Right. So now at that time, after 1 month, you don't like it and everything, then can we request another one? Like, do we have to go to the primary doctor, or do we have to go to sleep apnea center and tell them, we don't like this and we need to get alternate?
Well, so here is what, and I will tell you, as I said, I am a patient and I am the provider. So 12 years ago, I started noticing, and just like everybody else, my spouse told me, you are snoring. And I said, really? And I was in denial. I'm like, is that what you're going to tell me? He says, no, I am afraid. He's a man with few words. And he said, I'm afraid you are not going to breathe and you're going to die in your sleep. And it literally brought in front of my eyes. I'm like, wow. I still didn't believe him to a degree, till he actually videotaped me and showed it to me. And I thought, oh my God, this is scary. So I started research. Now, I had the privilege of being in the background, having the medical background to do some research. And I said, what? Of this disease that is so deadly for us, and there's only one treatment we have. So I started my education and I got my diplomate, and I said, it can't be. This is not an available treatment. So basically the doctors, the way our healthcare system is set up is only the medical world is set up with a DME company, and it's an automated process. When you get diagnosed, nobody sits down and tells you what this disease is about, what it can do to you, and why are you doing the treatment. Part of the whole education part of the process for the patient is taken away. And so you get a machine, you have no idea why you need to put the machine on, and you try it and you give up, right? And you say, well,
Right.
it's done. You don't know. So once you have tried it, here is your simple thing. Say, this treatment is not working for me. I would like to try an oral device. Can you give me, you need a prescription to another treatment. So your primary care can give it, or your sleep physician can give it. You can request it from whoever you have a relationship with. You can request them to give you the prescription. And once you have that, it will basically, you can find a provider who, like me, who provides the treatment for obstructive sleep apnea. So that is a glitch in our system, that everybody gets a machine. Nobody gets the choice of their treatment, to say whether this will work for you or which is the treatment you will follow rest of your life, because it's not going to go away. We have to comply till the day we go to grave.
You're right about it. Absolutely correct. Because nobody discuss about any other item. Just like you give the example about the blood pressure medicine, that one medicine doesn't work, you have other option to take another medicine or whatever. But on this one, nobody does. Now, my question next one is that, let's say I have this machine. Now it's been more than 7-8 months gone. Do I have to go through the sleep apnea, the diagnosis and everything again and go through that way, or I can just go to the primary doctor and tell them I don't like this one, and then I can get another oral advice?
Right. If you have the sleep study has to be within, are you on Medicare? That is my question.
No, no, I'm
okay.
I'm in the school, so I have a school insurance.
Okay, so if you're not on Medicare, because Medicare rules are different, so I just wanted to educate you on that. But if with the regular insurance, if the sleep study was done within last 2 years, it is still valid, and you can go request for the second line of therapy.
So do I have to go to primary, or do I have to go to the people who had done the diagnosis?
You can either or can give you that prescription. So you can go to the sleep physician and say, I don't like this machine. I'm not going able to comply with it for long term. I'm looking at alternative, and they should be able to help you.
Okay.
So whoever you have relationship with, even primary cares can do it if you talk to them, or sometimes if they don't want to, they'll send you to sleep physician. So I would start with sleep physician and then go to primary care.
I mean, it is tough to go through. I don't want to say yes, but 9 out of 10 times, the most of the doctors try to keep the patient with them rather than go to somebody else.
Right.
Thank you. Thank you. I like it. I like your presentation. Thank you very much for your help.
Oh, thank you.
So we will be sharing the recording. If you're interested, you can either contact, if you're through Dr. Rashmi Parmar, she will have the recording also with her slides and everything. Dr. Rashmi Parmar, I have one other question about the younger generation. You said that, it's a big problem with the gadgets, and me having a young boy at home, I do see that he does argue that, I do get my 7 hours of sleep, but the pattern is not consistent. And I think a lot of parents, even though many are not speaking here, I'm going to be the voice for them. How do we make them understand or aware of this problem? How do we do this?
Basically, with the younger generation, education is, it's, even though you're a parent, they're never going to listen to you. We have to consistently give them the message. And I see patients who are in their 20, 21-year-olds, college going, and I remind them, We have study after study showing that you cannot have an all-nighter and function even in your exams. If you read, when you go through, when you sleep, your brain actually reorganizes all that information. And then what I say to them is you can regurgitate on your papers next day morning. But if you say, I'm going to read all night long and go, you actually do poorly on those exams. So any young college going or high school going kids, we have to remind them that a quality sleep is important. That said, in young generation, their sleeping patterns change. They actually, we have a biggest fight right now with the high schoolers that they used to wake up at 6 o'clock. They need to actually wake up a little later. Their sleep phase cycle is a little bit different when you're in that teenage age. So they can sleep a little bit later in the morning and go to school. But we all still need 8 hours of quality sleep. It doesn't matter. And kids, young kids need 8 to 9 hours of sleep. So it's critical to communicate with on a consistent basis with the kids that sleeping is an important part of your health and healing.
Thank you. Any other questions anyone has? A lot of people have said that they love the presentation and they just wanted to thank you, Dr. Parmar. Any other questions in the group?
Yes, I have a question.
Yeah.
What about getting too much sleep? Your body is like, if I want to, I can sleep 10 to 12 hours and I feel like my body just wants to sleep all day long. What about that? And I still don't feel refreshed.
There you go. To your own question. We only need 7 to 8 hours of sleep. So here's what I tell people. Alarm clocks are modern man's invention to interrupt your sleep. We need to use the alarm clocks so that it reminds us it's time for us to go to sleep. Waking up happens automatically if you have quality of sleep. What you just described is you can sleep for 20 hours, you will still not wake up refreshed. Okay, so if you have bad sleep or you have lack of number of hours that we need enough sleep, you will see these people sleeping in the airports with their mouth open. You will see them at any time, any place, anywhere. It is not healthy. Remember what I said, 16 hours, we have to have enough energy to do whatever we need to do, 8 hours of sleeping and resting and healing. So when you tell me that you're sleeping 12, 15, 20 hours, it's telling me that you are just not getting quality sleep and you need to be assessed for sleep apnea.
Okay.
I have the same problem. So I think she said that younger people need 8 to 9 hours of sleep. And I think I'm young, so I think I need 8 to 9 hours of sleep. These are the few words. I think there was a couple of comments that said I'm a man of few words. Well, these are the few words.
Hi, ma'am. Good morning. My name is Rekha Lachenbaum. I have a question. Unfortunately, I came in late. I missed it. I just happened to see the message. Is it possible to see your presentation somewhere later or somewhere? Because I do have sleep apnea also, and I just came across this message in a chat, and I was wondering, I just missed it. Is it possible to hear what you said? Because I logged in very late. I apologize.
Sure. How did you get the message from?
It was my husband's chat. He mentioned it to me, actually. He is on a WhatsApp chat, and he mentioned it to me that it is there. This might interest you. And I somehow got late. That is how I got to know.
So we will
But
be, I will be sending the recording in, I think, that same chat, the WhatsApp group he is in. So you should have it.
Would you be sending it there?
Yes, I will.
Okay, thank you so much.
You're welcome.
You're welcome.
Any other questions?
I guess not. Thank you. Again,
Just so that Avni knows, she does support Dunkin' Donuts.
Well, not with my caffeine kicks for sure.
Well,
No, thank you guys for giving me the opportunity. I hope that it helps everybody think about it and get the help they need. Thank you, Shopaban and the Jane
Dr.
Society
Parmar,
of
I am going to
Washington
be your next
Metropolitan.
patient. I'm going to be your first next patient,
Absolutely. It will
I'm
be
going
my
to take a
pleasure to
visit and see you
help anyone.
soon. So also, somebody asked about how they can get presentation. We are also going to post it on the JSMW's website. So that is another way you can also get this presentation. It's jsmw.org.
Okay, thanks so much.
Of course, of course. Thanks for joining, everyone. Appreciate everyone's feedback. Dr. Parmar, it was a great presentation again. Appreciate your time this morning and your better half somewhere, Kirit Bhai. Thank you so much again for helping helping us out with this.
Oh, thank you. Have a wonderful weekend, everybody.
Thanks. Bye-bye.
Thank you.
Bye-bye. Thank you.
Bye.